Welcome to The Explainer. Today, we are digging into a fascinating medical mystery. We're talking about serious leg pain that hits young, healthy people, stopping them right in their tracks when they should be at the top of their game. So, picture this. You're an athlete, you're in great shape, but every single time you go for a run, a crippling cramp in your legs forces you to a dead stop. This symptom has a name. It's called claudication, and it usually points to artery disease in older folks. So what in the world is going on here? Yeah, this is not your typical case of clogged arteries from plaque buildup. That's atherosclerosis. We are looking at a completely different beast here, one that affects young, active people who have none of the usual risk factors. It's a real diagnostic puzzle, and because it's so rare, it often gets missed, leading to years of disability. Okay, let's dive into this medical mystery and meet our two main suspects. The first is Popliteal Artery Entrapment Syndrome, which we'll just call PAES. And the second is Adventitial Cystic Disease, or ACD for short. First things first, let's take a closer look at the core symptom that brings these young, active people into the doctor's office to begin with. So the whole issue revolves around claudication, and really, that's just a specific kind of pain that pops up during activity when your muscles are screaming for more blood, but then it vanishes when you rest. It's a huge, flashing sign that blood flow is being choked off somewhere. Now, since atherosclerosis is almost always the cause, doctors really have to think outside the box for these younger patients. And a delayed diagnosis isn't just frustrating. We're talking about years of unnecessary pain and potentially even more serious limb-threatening problems down the road. So let's move on to our first suspect. You can think of this one as the anatomical trap, and it's all about how you're put together. In Popliteal Artery Entrapment Syndrome, the main artery that runs behind your knee, the popliteal artery, gets squeezed and compressed by the muscles and tissues that are right next to it. So it's not a blockage inside the artery, it's a squeeze from the outside. Now, here is a wild statistic. Even though these conditions are super rare overall, PAGES is actually the culprit in up to 60% of young people who have this kind of leg pain. That is a massive piece of the puzzle for any doctor trying to figure this out. You know, a really great way to visualize this is to just think of a garden hose. With PAES, it's as if the hose has gotten twisted into a kink or somebody is literally standing right on it. The water, or in this case, your blood, just can't get through properly. And as you can see, PAES isn't just one single thing. It's actually broken down into several types based on what the specific anatomical problem is. For instance, in types 1 and 2, the artery just takes a weird path. In others, like type 3 or VI, it's being squeezed by an unusual muscle band or even just by huge muscle growth in athletes. This variety is part of what makes it so tricky to pin down. Because it almost exclusively hits young, active people, it has earned a very, very fitting nickname among doctors, the jogging disease. All right, time for our second suspect, Adventitial Cystic Disease. This one is less of an anatomical trap and, well, more of a mysterious intruder. So what in the world is ACD? It's a super rare condition where a cyst, full of this gel-like gunk, actually forms inside the wall of the artery itself, and then it squishes the artery shut from the inside out. And where does it happen? Well, believe it or not, it happens overwhelmingly in the exact same place as PAES. More than 80% of ACD cases affect that popliteal artery right behind the knee, which is a big reason why their symptoms look almost identical. Let's go back to our garden hose. Okay, so if PAES is like someone stepping on the hose, then ACD is like a weird bubble forming within the rubber wall of the hose itself, pinching the tube closed from the inside. Okay, so where does this crazy cyst even come from? Well, the leading theory is called the articular theory. It suggests that fluid from the knee joint capsule actually leaks out, finds its way into a tiny connecting blood vessel, and then travels into the wall of the bigger popliteal artery, where it just pulls up and forms a cyst. This internal squeeze creates some really unique visual clues for doctors. On an angiogram, which is basically an X-ray of the blood vessels, the squeezed artery can look like a curved sword. That's called the scimitar sign. Or it can get pinched on both sides, creating what they call an hourglass sign. So we've got two suspects that cause almost identical symptoms, but come from completely different places. How in the world do doctors tell them apart and actually solve the puzzle? This table right here really highlights the key differences. For PAS, we're looking at that external compression, usually in a younger guy, and the symptoms often get worse when you flex your foot up and down. For ACD, it's an internal compression, typically in a man who's a bit older, and a huge diagnostic clue is losing the pulse in the foot when the knee is bent sharply. That's a telltale sign called the Ishikawa sign.
Finally, let's wrap this up by looking at how these conditions are treated and what the really important takeaways are from this medical deep dive.
For PAES, the treatment is pretty direct and logical. You have to release the trap. A surgeon literally goes in and cuts the bit of muscle or tissue that's squeezing the artery. And if the artery itself is damaged from years of being compressed, they'll either repair it or replace that section, usually with a piece of vein from somewhere else. With ACD, the goal is just to get rid of the cyst. A less invasive way is to just drain it with a needle, but there's a pretty high chance it'll come back. The more permanent solution is to surgically remove the whole section of the artery that's affected and then replace it with a graft. So, after exploring this whole complex medical mystery, from anatomical traps all the way to mysterious cysts, what is the single most important thing that you should remember? The biggest takeaway is this. If you are young and healthy and you have leg pain that consistently shows up with exercise, it should never be dismissed as just a muscle strain. It is a clear message from your body. And as we've seen, the cause might be rare, but it's often totally treatable. The key is to listen to your body and be your own advocate to get the right diagnosis.